Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest is Dr. Adolfo Ramirez, and he's here to talk about a brand new Parkinson's Foundation podcast that highlights a wide range of Parkinson's topics. Welcome to the program, Dr. Ramirez.
Thank you. Thank you for the invitation. It's an honor, really, to be able to talk a little bit about Parkinson's disease and what I do. I'm a neurologist, and I specialize in the treatment of movement disorders. Movement disorders are a group of conditions that are characterized by not enough movement or slowness of movement, or actually excessive movements. I've been working at the University of Florida for about almost a year, I would say, and I primarily dedicate my practice to see patients with Parkinson's disease, which account for the vast majority of patients.
Now, getting into Parkinson's causes, are there any more developments as far as the cause of Parkinson's?
Yeah, well, we used to think that Parkinson's was not a genetic disorder, and now there are at least 16 well-established genetic conditions that can cause Parkinson's disease. However, that's rare. What we know now is that the cause of Parkinson's disease, it's a combination of the perfect mixture between risks caused by your genes and exposures through the environment. So we think that complex interaction between the environment and your genes and age is probably what's causing Parkinson's disease.
Would you say that age is kind of the catalyst for the onset, whereas it's been lying dormant genetically for, since birth?
That's part of it, for sure, because age is by far the strongest risk factor for Parkinson's disease. Everyone's chances of getting the disease increase significantly as we get older. But there are other concerns. There are some established risk factors for Parkinson's, like exposure to pesticides, rural living, or well water. Not everybody that lives in the rural areas or that has an exposure to pesticides gets Parkinson's disease, but those are some of the established risk factors for Parkinson's. So it's a combination of all those three things.
How significant is early proper diagnosis as that diagnosis relates to future quality of life for the patient?
Yeah, that's a really good question, because for many years, people were afraid of taking medications for Parkinson's disease because there was this concept that medications will stop working eventually. So you were kind of trying to save the medication effect for later. But now we know that the early that you start the right therapies and the right treatments, not only medications, but physical therapy and speech therapy, patients have better quality of life. There are studies showing improvement in activities of daily living and quality of life. So having a diagnosis is really important and critical.
And because of the diversity of those affected by Parkinson's, I mean, we're talking decades of longevity, not just a few years, right? And more.
Yeah, no, absolutely. So there are patients with Parkinson's disease, like the image of somebody with Parkinson's disease is, for most of us, would be somebody in an elderly person that has tremors, but people also get affected by Parkinson's early in their 40s or 50s or even younger. So their lifespan with the disease, it's 20, 30, sometimes even longer than that, many, many years.
What about injury to the brain? Can that contribute to early Parkinson's or the acceleration of the symptoms?
So that's a little bit of a controversial area, because we know that there are some studies suggesting that head injury may increase your risk of Parkinson's disease, but it's not very conclusive. There's controversy about it because it's very hard to study that, going back and trying to analyze an injury and how that is going to affect your brain decades later is very difficult. But there's some data that may suggest that if you have the right genes, the head injury may actually have an effect going forward, but it's not conclusive.
Do you know of any type of cognitive exercises or things that may be implemented, some advice or tips for people who may be taking care of those who are affected by Parkinson's? Are these some of the things that maybe covered in your podcast.
Yeah, so the podcast actually covers a variety of topics. It's a really new initiative by the Parkinson's Foundation, and it really covers different ways to understand the disease and also gives you tips to how to live better with Parkinson's. And going back to the question, there are a variety of therapies that are very useful for patients with Parkinson's disease, not only cognitive therapies, but also physical therapies. Exercise is really important in this disease. People do significantly better, and you need to do a variety of exercises, not only cardio, but you want to do flexibility and strengthening exercises.
How often does your podcast air, and what other endeavors as far as bringing awareness to some of the latest findings in Parkinson's research are concerned?
I think there's a significant change. There has been a significant change in the way that we're doing research for Parkinson's disease, because it's a very active area, and it can be divided in research looking at better treatments for the symptoms of Parkinson's disease, and also the treatments that are looking at slowing down disease progression. So there's very active research for both, and we're hopeful that within the next few years we can understand better what's causing Parkinson's and how to slow it down.
Did you notice any findings that say that maybe men get it or affected more often than women, or vice versa, or is it kind of a random thing as far as the numbers?
Yeah, it's a great question. There is actually the numbers have changed, but it's consistent that males get Parkinson's more than females, and the ratio is about 3-2. We don't understand why, because women live longer than male, but it seems like there's a little bit of a risk factor being a male to develop the disease. It's about a 3-2 ratio.
Where can we listen in on your podcast?
So the podcast, I forgot to answer the question. The podcast airs every 2 weeks, every other Tuesday. And it's available and free at the Parkinson's Foundation, the National Parkinson's Foundation. So if you go to www.parkinsons.org podcasts, then you can find the podcast and you can go back and listen to some of the previous podcasts. One of the important features about the podcast is that they're very brief. They're about 15 minutes long, and they're useful, they're practical. So trying to give tips to patients to understand the disease and how to live better with the disease.
Well, I appreciate you coming in and speaking with us today, Doctor.
Yeah, no, thank you so much. And I encourage all your listeners to go and check out the webpage of the Parkinson's Foundation. There's a lot of really good information for Parkinson's, and to find resources, which is one of the biggest missions for the Parkinson's Foundation. And it's also in the Spanish, so questions can be asked to doctors in the Spanish.
Dr. Adolfo Ramirez, currently an associate professor of neurology and director of the clinical trials at the University of Florida Center for Movement Disorders and Neurorestoration. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.